Hello friends, welcome to I Gurukul. Friends, today I brought here new topic, that is the introduction to refractive errors. Okay, so before going to start my today's session, I would like to request you all, please subscribe my channel and hit the bell so that you will get all the notifications whenever I am uploading the new sessions on this platform. Before going to start this session, there are few objectives of this session. So at the end of this session, you will be able to define the refractive errors and refractive medium of the eye. You will be able to explain the terms ametropia, emmetropia and accommodation. You will be able to list the types of refractive errors. You will be able to narrate the signs and symptoms of each refractive errors. So these are the objective of today's session. So basic geometrical optics, what it says. So the refraction of light, how it travels. The light bent or refracted as it passes from air into water and other transparent materials. So you can see in this image, the pencil has kept in the glass of water. The normal out of the glass, the pencil is seeing clear, and in the glass, empty glass, it is showing little magnified, and in the water again it is showing magnified. So this is the refraction of the light, how it travels from the one media to the another media. As a basic of geometry, now we will study about the vergence. The stimulus movement of the pupil of the eye towards or away from the another during the focusing, that is called vergence. The light rays travelling parallel are zero angle, that is called zero vergence. Okay. The rays of light focus at the point are converging rays, that is has plus convergence or plus vergence. All the naturally occurring source of light are divergent, for example sunlight or sun rays. These diverging rays are minus vergence. Vergence are measured in diopters and is denoted by letter capital D. So now we have here options how the light rays travel from air to ocular media. So I have given here multiple options. So you have to rearrange the medias through which light passes. So these are the options are available here on the screen. So can you recall the anatomy and visual pathway which I taught in the previous sessions? So we can compare the human eye to the camera. The image produced on the camera is inverted. Likewise, the image is inverted and fall in the eye. So how the light rays reaches to the retina from anterior to posterior, how the light rays travels, one by one you can uh, rearrange these options. So the first where the light fall, that is the media, is the cornea. On the front surface of the eyeball, that is the cornea. When light fall on the cornea, it converges and it passes through the uh, aqueous humor, and then it fall on the lens. During this process, the pupil is control the amount of light entering the eye. So unwanted lights are blocked by the pupillary, or uh, the sphincter muscle is helps to control the pupillary actions. So it constricts when the bright light fall on the eye, and it dilates when the light is insufficient light you have, or a darker, or in the evening time. And then the lens through the vitreous humor it passes, and finally fall on the retina. These are the uh, medium through the light travel and focus on the retina. Now we'll study about the how the image forms on the retina. So the question is, what makes a sharp image on the retina? We'll revise quickly. The light from the object enters the eye in the form of light rays, and then the light passes through the tear film, cornea, anterior chamber, pupil, crystalline lens, and then vitreous before arriving at the retina. It travels through these media, as I said earlier in the slides. The rays of light are converged, focused by the cornea and the crystalline lens. If the light focuses correctly on the retina, a clear image will be formed. At the retina, light is changed into electrical signals, that is the nerve messages, and the information received by the retina is sent to the brain via through the optic nerve. The light gets correctly focused on the retina because of the correct shape of the cornea and the correct shape of the lens and the eyeball. It is the correct length. So we have average anterior to posterior length of the eyeball, that is called axial length. Average, it will be 24 millimeter from the anterior surface of the eyeball to the retina. So this is the how the image focus on the retina and it travel to the brain. So moving towards the refractive errors, the definitions. Some of the people are able to see near objects clearly and some are able to see far off subjects clearly. Why? Can anyone answer this question? The answer is the ability of the eye to accurately focus the rays of light on the retina. If the rays of the light do not focus on the retina, a blurred image may be seen by the person. This condition is known as refractive error. Okay. As I said, this refractive error is not an disease but the abnormalities of the eye. So when the parallel rays of light focus on the retina, that is what we call the emmetropia. During this condition, the accommodation will be at rest in the condition. So here the second image is the showing, that is the rays of light focused in front of the retina, that is what we call the myopia, and the rays of light focused behind the retina, that is what we call the hypermetropia. Okay, refractive errors are measured in the diopters. So there is a quick question again, what causes the refractive errors? The answer is the curvature in the lenses that gives the optical power to the lenses. The term refractive error state refers to the ability of the eye, refractive elements of the eye, namely cornea and the lens. The refractive errors are caused due to the many reasons. Those are axial length change in the eyeball and the change in the refractive index of the ocular structure and the change in the curvature of the lens or in the cornea. So we'll go one by one how the changes occurs and how it affects the vision. The change in the axial length of the eye, that is the distance between the anterior surface of the cornea and the fovea, that is on the retina. If the eye is too long, light is focused before the retina, causing the nearsightedness. If the eye is too short, the light is focused by the time it reaches the retina, behind the retina. This is causes the farsightedness or hyperopia, what we say. And then coming to the next point, that is the refractive index, the ratio of the velocity or a speed of the light in the vacuum to its velocity or speed of in the specified medium, how the light rays passes, and this is the ability to bend the refractive uh, or this is the ability to bend the light rays, that is the refractive index. Sometimes it changes in the ocular structure, those are cornea and lenticular changes, okay, that affects the vision. And then third point, that is the change in the cornea or in crystalline lens curvature. The curvature of the cornea, if the cornea is not perfectly spherical, then the image is refracted or focused irregularly to create condition called astigmatism. A person can be nearsighted or far-sighted with the or without the astigmatism. Coming to the second in the change of the curvature, that is the change in the curvature of the lenses, that is crystalline lens. If the lens is too steep or sharply curved to the length of the eye and curvature of the cornea, this causes nearsightedness. If the lens is too flat, the result is farsightedness. Friends, moving towards the emmetropia and ametropia. As you know, the light always travels in a straight line. Light from the object enters to the eye through the cornea, aqueous humor, lens, and then vitreous humor, and form an inverted image on the retina. This you all know, as I explained in the earlier slides. Now, can you explain the how the what is emmetropia and ametropia? The emmetropia term in the medical term, that is the normal eye. The normal eye will able to read the last line of the Snellen's chart, which is we are using to record the visual acuity, which will be documented as an 6 by 6, that is in the emmetropic condition. This will also indicates that the ocular medium through which the light travels is in a line and in the normal condition. Okay. And then what is ametropia? The vision is not clear for near objects or far objects or have very blurred vision. In this situation, either rays of light focused in front of the retina or behind the retina, sometimes one meridian focus in front or another meridian will focus behind the retina. Okay, this is what we call ametropia, which includes the type of different types of refractive errors. Friends, now moving towards the types of refractive error. In the ametropia, we have different refractive conditions of the eye. So we'll look one by one. We'll have a first, that is the myopia, and the another name for the myopia is short sightedness. In this situation, the rays of light when the coming from the infinity, parallel rays of light coming from the infinity, these are focusing in front of the retina with the accommodation at rest condition, that is called myopia. This myopia can be corrected with the spectacle lenses, that is the concave lens we use, and second option is to correct the myopia, that is the we have a contact lenses, and then third option is surgical. We can look into the detail in the next session. Those are the LASIK refractive surgery we can call. So these the basic treatment option is for the myopia is the spectacle lenses, that is the concave lenses. And coming to the next point, that is the hypermetropia. The another name for the hypermetropia is long sightedness. In this situation, the parallel rays of light coming from the infinity, these are focused behind the retina when the accommodation is at rest condition. So to correct the hypermetropia, we use convex lenses, and the another second option is the contact lenses, and the third again we have surgical options for the hypermetropia. As I said, in the myopia also we can treat here also with the spectacle, contact lenses and surgical process. Moving towards the third option, that is the astigmatism. In this condition, the parallel rays of light coming from the infinity, they are not focused on the retina, they focus in the multiple focal points, some of them in front of the retina, some of them on the behind the retina, some of them on the retina. So these are not focusing on unique single focal point, with the accommodation will be at the rest condition. So multiple focals will be treated or corrected by the spectacle lens. Those are cylindrical lenses, maybe in the pure cylinder or combination of compound cylindrical lenses, or in mixed astigmatism conditions we use cross compound lenses also. The first primary is the spectacle lenses. Second option, as I said, again here also we can prescribe the contact lenses, and the third option we can manage with the surgical procedure. So, and coming to the last one, that is the presbyopia. Presbyopia means that it is an aging process where we need to correct the near vision as the age grows. It's effective from the age of 40. For the near vision correction, we need to prescribe the addition or in spectacle lenses, and or you can have again contact lenses options are there, and the third option surgically we can manage this condition. In this situation, what happens, the accommodative power of the lens is losses, and then we have to add the spectacle lenses in front of the eye. So we use convex lenses to treat the presbyopia. As I said, in the hypermetropia also we use the convex lenses. Again for the presbyopia also we use the convex spectacle lenses. So moving towards the, we'll go through quick activity that how the lenses act, or how the images are seen through the different lenses. As I said in the previous slides that minus lenses are used to correct the myopia, or plus and plus lenses are used to correct the hypermetropia. Cylindrical lenses, whether those are minus or in plus form, those are used for the correction of astigmatism. We'll look through the first the concave lens, how the lens is looks through the, how you look an image through the lenses. The image seeing in this slide, that is showing that magnification of the image. See, the students are sitting in the class, so when you viewing this through the minus lens, it shows magnification. The entire class is seeing through the lens, so it makes a magnification. That the concave lens is a reducing lens, it reduces the image size, that is the image looks smaller. A negative image bends the rays of light outwards and spreads them away from the focus. It is called the minus lens because it subtracts the lessness of the curvature of the eye. So how does the images looks through the minus lens? That is, you can see in the, as I said, this is magnification happens with the minus lens, and when you move this lens horizontal or in vertical, however the images are moving towards your movement of the lens. That means the image movement will be with the movement in the minus lenses, and the image is smaller and upright only, okay, with the minus lenses when you look through these lenses, okay. With the hyperopic lens, you can just check with your minus lenses or and plus lenses. When you hold an hyperopic lens, that is the plus lens or converging lens. So in this lens, the hyperopic lens, the image is magnified and the movement of the object through the plus lens, it shows the against movement. If you are moving the lens your right side, the image will move your left side. So this is the what you can see through the plus lens. And if you hold the lens, plus lens, and you look an object, that will show you the inverted image with the plus lenses. So this is what we can see through the plus and minus lenses. As I said, to correction of astigmatism, we use cylindrical lenses. If you hold an cylindrical lenses, that lenses will show you minified image or tilted or an oblique, stretched image, because the surface are not an similar in the both meridian. So that's the causes the image tilt or an magnification with the power myopic power, magnification with the hyperopic power in the cylindrical lenses. So now we'll look through one by one how the lenses are used and to correct the refractive conditions. One by one refractive errors. What is the definition? What are the symptoms? What are the signs of these conditions? The myopia is short-sightedness. As I said, in this condition, the light rays will not focus directly on the retina, but the image fall in front of the retina. In this situation, eyeball length is longer than the normal and the corneal curvature is the steeper than the normal. This can be corrected using the concave lenses. As I mentioned in the earlier slides, this myopia is nearsighted. If you see, the child is clear, but the person who behind the child is unclear. In the myopic condition, you can see like this. This is the real image, how the myopic conditions people can see their routine life. So if you treat the myopia with the concave lenses, okay, so he will be more clear for the distance as well as the near. The myopic condition may be from the birth, that is what we call congenital, or it must have developed as the child grow. The eye power changes as they grow, or due to some other ocular diseases, myopia must have been developed. Okay. The symptoms in the myopic condition, the person will be able to see near objects clearly, but the far objects will appear to be blur. Okay, as you see in this image is showing that the distance object the person is not clearly seeing, but the near the child is clearly seeing. What are the signs in this condition? The eyes are prominent, large optic disc you can see in the fundus, crescent around the optic disc. Fundus appears as a tigroid, having a stripped or a spotted appearance on the retina. So these are the signs you can see in the ocular structure. As I said, the eyes are prominent. You can see externally this one, but the large disc, crescent around the disc, these are the retinal changes in the retina. So you have to dilate and see the changes. So that will be covered in the next upcoming sessions. So if you correct the myopia with the spectacle lens, how it seeing, the near as well as the distance will be clearer with the correction of concave lenses. Okay. Now moving towards the quick assessment. The question is, what is normal vision? Answer, can anyone answer? The correct answer out of these options. Option A is ametropia, option B is emmetropia, option C is myopia, option D is hyperopia. The correct answer is emmetropia, the normal vision. When the parallel rays of light coming from the infinity focus on the retina with the accommodation is in the rest. Okay, moving towards the next question, that is, what is the lens, which lens or what lens is used to correct the myopia? The options are option A convex lens, option B concave lens, option C cylindrical lenses. You can guess, as I said many times repeated, these treatment options for the myopia, that is the concave lens. The correct answer is concave lens. Okay. Now moving towards the hypermetropia, that is long sightedness. Hypermetropia is otherwise called as long sightedness. As I said, the rays of light in such patients will focus behind the retina. In this condition, the rays of light are going to focus behind the retina. That is what we call hypermetropia, with the accommodation will be in the rest condition. Can you answer how will the vision will in such patients look like? If hypermetropic patient will comes to you, how will he say how he is seeing through the eye? What are the complaints he will say you? The patient will be able to see far objects clearly, near objects are blur. Here you can see in this image the nearer closer to your eye, that is the child who is working here, that is blur, but the distance is clear. A far sighted lens or a convex lens is called magnifying lens, positive lens also we can call, or the plus lens, because it magnifies the enlarges the things. Because of magnifying effect, it enlarges the images, then you can see the distance clear. Why the plus lens is advised for far sightedness or in hypermetropic patients? Can anyone answer? A positive lens is advised because it is thicker in the center and the thinner in the edges. It bends the rays of light inwards and brings them focus and adds the curvature to the far sightedness eye. So that makes an focus on the retina. At that time, patient will see clear distance as well as near with this correction. We use plus lens or an convex lens or an magnifying lens, you can say. These are the corrective options for the hypermetropia. Okay. So the astigmatism. What is meaning the astigmatism? The astigmatism word came from the Greek word, that is a means without, stigma means a spot. The light rays are not focused equally on the retina. Okay. In astigmatism, the light is not able to focus at the point but focus on more than two different planes because of the curvature and shape of the cornea of the eye. Light rays are not focused equally on the retina in this situation. Astigmatic eye will have two different powers in two different meridians. This is due to the shape of the cornea and the lens, like rugby ball. It is a game like a football, which means the eye is not spherical. So there is no focal point, single focal points on the retina. They can be focused in the multiple focal points. Okay, and it may occur on it may occur on its own or may be associated with myopia or an hypermetropia. Okay, symptoms with this condition will patient will complain the tilt in the head to see the objects, headache, defective vision or blurred vision, eye strain, squinting, giddiness, these are the symptoms of these conditions patient will report you. What are the signs you can see on the ocular structure? Astigmatism makes it difficult to see the fine details either close up or from the distance. Okay. So you can't manage, you can't find out immediately that astigmatism condition is there in the patient's eye. So it needs some measurements. So moving towards the types of astigmatism. Here the principal rays are not focusing one focal point. So we have two types of astigmatism. One is regular astigmatism and the second one is irregular astigmatism. Okay. So we'll talk regular astigmatism. The principal two meridians, that is horizontal and vertical meridians, are at the right angle, means 90 degrees. The steepest and the flattest meridians of the eye are called principal meridians. Okay. And with the irregular astigmatism, when the two principal meridians are not perpendicular to each other, the curvature of any one meridian is not uniform. So in this condition there is a difference between the angle, as in the regular astigmatism you can say both meridian have a 90 degree apart. Okay. In this you can see the variation in the two meridian of the angles, difference will be there. So to treat astigmatism we use an cylindrical lenses or spherocylinder lenses can be prescribed in this condition. Okay. This is the treatment options where we can prescribe to the astigmatism condition. Now we'll go through the power of accommodation. Many times I have told that during this refractive conditions the accommodation will be in the rest. So what is means the accommodation, what it means? Okay. So we'll look through this slide. So coming to the exact how the accommodation happens, in this image picture, when the seeing a distance object the lens becomes flat, that is the ciliary muscles relaxes at the time the power of the lens is normal. While focusing for the distance the lens gets flattened. In the second picture you can see when the seeing for the near objects the lens will increase its power at a time the ciliary muscles contracts, that is what we can call accommodation. This is the condition where the distance lens gets flattened, focusing for the near objects or the lens gets convex or a more spherical power. We will move towards the activity, quick activity, how the accommodation happens in the eye. So I can ask you people to look at far objects and look at the near objects simultaneously. How the objects appear? The answer is you can see distance and near simultaneously clearly. Okay, how it is possible? Can anyone imagine? Here I can show you then example, the distance where you are sitting, you just look at the distance object. We can select here wall mounted watch, and on the wrist watch you can see these are the two options where distance and near we can immediately compare. How these images are seen clearly? So this is because of the nature of the lens in your eye. The lens changes its optical focus of the eye to see the distance and near objects clearly only with the support of the ciliary muscles as they contracts and relaxes. This process is known as the accommodation. Okay. So this is, you can just check how the distance objects and near objects seen clearly. So the quick movement from the distance to near to distance, that is the because it happens because of the process happens in the ciliary muscles, that contraction and relaxation, that process is called as accommodation. Okay, so moving towards the presbyopia. So as I said, this is the aging process. So I have an example how to explain for this condition, that you can take any hairband and keep on the elongated and shrink the band for few or more times. What will happen with the hairband? It might lose its elasticity, because the multiple times you are holding the or changing the curvature, okay, and you are stretching that hairband. Similarly, as we get older, the lens is controlled by the zonules to accommodate for far and near objects. But as we grow old, the zonules loses its elasticity and lens will not be able to flatten or become round for near and far objects, focusing these two different focal distance. So it becomes difficult for older patients to look clearly at far and near objects. How the patients will report you? The symptoms they will tell you: inability to focus near objects while reading, that is what we call reading difficulty. Headache also they will tell you that while reading and or handling near activities they can face the headache problems. Watering of eyes is there, and tiredness of eyes will be there, and also eye strain will be there. These are the symptoms that patients reports you while the examination. How the signs, what changes you can see in the presbyopic condition? At the beginning stage, people start to hold the things further away from their eyes in order to see clearly. Difficulty doing the near work, that can cause you to hold your near reading material or in mobiles or in near activity, whatever you are looking through for your near work. So you have to hold away from your eyes little. So at that time you can focus because of the elasticity loss, and you can accommodate at particular distance. For presbyopic patient, the spectacle will be bifocal spectacle, which will have lens power to view far objects and near objects simultaneously. Okay. The another type of spectacle is multifocal spectacles, or we can call that is progressive lenses, progressive addition lenses we can call. For those who have prescription for near only, they can also use progressive lenses, bifocal lenses. Those who have distance as well as near prescription, they can use bifocal and progressive addition lenses. And the new options, another option, that is contact lenses, are also prescribed to correct the presbyopic conditions. As I said, in the myopia, hypermetropia also we prescribe the contact lens. Similarly, in hypermetropic patients also we prescribe contact lenses. Those are multifocal contact lens, monovision lenses, many options are there. Okay. As I said, how presbyopia is corrected just now only. So what are the options available to correct the presbyopia? That single vision also can be prescribed for only near activity. Those who have limited near activity, they can use single vision prescription, that is the single vision glasses. And those who have high volume, means maximum work for the distance as well as near simultaneously, they can wear bifocal lenses. And the third one is the spectacle, which is the multifocal lens, what we can call progressive addition lenses. This is also used for the to correct the presbyopia. So for you can show with your different patients, those who comes to you, that what are the different spectacle options are there. As I said, single power spectacle lenses can be used, and bifocal also, and the third one is multifocal lenses. Multifocal lens will give you an additional benefit to focus intermediate objects, where this is the in between the distance and near, after the 40 centimeter to the 100 centimeter, this is the intermediate. So this progressive addition lens will help you to see near objects, intermediate objects and distance objects clearly. Okay, moving towards again the next, repeatedly we are assessing you during my this session. So here the new question, astigmatism causes the person to see a distorted image. Is it true or false? The correct answer is true, because the astigmatism has a multiple focal points, so that's why the patient can see the distorted images. This is the refractive condition. Okay, coming to the next question, that is, what causes difficulty in reading? In which condition the patient feels the difficulties during the reading? The options are hyperopia, myopia and presbyopia. These are the condition in which condition it caused the difficulty for reading. The ultimate answer, correct answer is presbyopia. It's an aging process where the accommodation power is lost, so they need reading prescription. So with the condition of presbyopia, patients may feel difficulty for reading. And moving towards the next question, that is what is the lens used to correct hypermetropia? So options are convex lens, concave lens and cylindrical lens. These are the types of spectacle lenses. Which lens is used to correct the hypermetropia? As you know, the correct answer is the convex lens. This is to converge the rays that will bring you the rays of light focus on the retina, where in hyperopic condition the distance rays coming from the infinity and they focus behind the retina. This plus lens will act as a converging lens. So the correct answer is convex lens. So these are the assessments where we can conduct it here. So moving towards the treatment options for all the refractive errors. So commonly, what are the basic options do you have with your uh, refractive conditions? So the primary option to correct the refractive errors is prescribing the spectacle lens. It may be spherical or cylindrical spectacle lenses. Second option is the prescription for the contact lens. So you can prescribe contact lenses, different types of contact lenses, different for the different refractive condition. And the third one is the LASIK surgery, where you can mechanically modify the cornea and then you can create an surface changes on the cornea and then you can treat with the LASIK surgery. These are the three options for the treatment as of now, the refractive errors of the eye. So moving towards now the activity. So I would like to request you all, you can select your multiple case records wherever you are working with the opticians or in optical stores or in hospitals, individual practice and multi-speciality hospitals, where you have treated many patients for the refractive conditions. So find out few case papers or in medical records. So and you can go through the medical records, let them completely read the all the documentation. Okay, so that the documentation means medical record, it contains the complaints of the patients and history of the patients, diagnosis and what are the treatments prescribed or in treatment options were given to the particular patients. So this activity you people can conduct, type of refractive error and its corrections. So I personally request you go through many refractive conditions where you have prescribed the spectacle lenses, contact lenses, what surgical procedures you advised. So that will help you to judge the patient's condition, and so that whenever next time the patient will come, you can directly confidently you can tell those patients, okay, this is the primary action, second reaction is the third this one, and the third one is any surgical activity you can explain. So that will help you to um, take a conversation with a confidently. So this is the activity you can do with your own medical records, where uh, during this session what we learn today. So this is the mind map what we can recall just. So the topic was refractive errors, types of refractive errors. Okay, the initially we have gone through the definitions. So and then refractive state of the eye, that we did the accommodation study on the accommodation, and then causes, and the causes includes that axial length, refractive index of the lens, curvature, and the curvature of the lens and cornea. These we have studied, and then we came to types of refractive error, that emmetropia and ametropia. The emmetropia means no refractive error, where the patient can see 6 by 6, that is normal vision without the correction. Ametropia, it consists 4 types. First, that is the myopia, hypermetropia, astigmatism, and presbyopia. And then we came to the management of all these refractive errors. So the primary action for the correction is the spectacle, and then secondary is the contact lenses, and the third one is the LASIK surgery. These are the refractive management options for the refractive errors. So I have already came to the end of this today's session. So if you have any questions related to today's topic, or particularly this topic, please comment on the comment box, so that I am able to answer your all the doubts and clear the doubts, and I am responsible to answer your all the questions. So before going to end my this today's session, I would like to request you all, like my session, comment how you gone through, how much you liked, how it is helpful for you people, and please share these videos with your friends or family members, those are interested to learn in the optometry subjects and the type of refractive errors, what are the treatment options, so they can go through this video. And don't forget to subscribe and hit the bell, so it will indicate you all the time whenever I am uploading the new sessions on this platform. So you will be directed or indicated through the email or an YouTube notifications. So thank you.